name is Dr. V. Mohan. I am chairman of Dr. Mohan's Diabetes Specialty Center and the Madras Diabetes Research Foundation in Chennai. I have something very exciting to share with you. This morning at the ATTD meeting here in Florence, we had a very exciting presentation of the International Diabetes Federation IDF position statement on the 1 hour value in the OGTT, which is presented by Professor Michael Bergman. Now, we have been working with Professor Michael Bergman and his team for many years now, and a group of people who are interested in this problem of doing oral glucose tolerance test. As you know, many people in the world say that the OGTT or the oral glucose tolerance test is not necessary, but there are many of us who still believe, we are old guard and we believe that the OGTT still has its use. Now, what happened was that the OGTT originally was a 5 sample GTT test: fasting, 30 minutes, 60, 90 and 120 minutes. Somewhere about 25 years ago or so, the 1 hour value, 30 minute and 90 minute values were discarded, and only the fasting in 2 hour is now used in clinical studies, epidemiological studies. They do a fasting in 2 hours and nothing in between. There are a lot of us like Dr. Michael Bergman, Jaco Tumalto, Ram Jagannath and many others who believe that the 1 hour value is also very important. For example, you can have a person who has a normal fasting and a normal 2 hour. But if the 1 hour value is elevated, you can't even call it pre-diabetes, because all the diabetes, pre-diabetes is dependent on the fasting and the 2 hour value. But the 1 hour is elevated in somebody who is otherwise thought to have normal glucose tolerance, we find that those individuals progress to either pre-diabetes or diabetes. We have done a lot of work on this at the Madras Diabetes Research Foundation, and our data was also shared, and it's part of this document which is positioned as an IDF position statement, where we are now saying that the 1 hour value, which was earlier dropped, has to come back when you do an OGTT. Makes perfect sense if you think about it, because you have to take a fasting and you have to take a 2 hour anyway. The person is simply sitting in the lab doing nothing. Why would you not take one more sample in between if it is going to give you much more information? And glucose is not an expensive test to do. It's quite a cheap test. So while they're waiting there, if you take one more sample, it will help to identify what we can call as pre-diabetes, And if you really want to prevent diabetes, you should detect it at a very early stage. And that is where this 1 hour value comes into play. So I would recommend that all of you who are doing an OGTT, please include the 1 hour value also. If that 1 hour value is 155 milligrams per deciliter or above, even if the fasting is normal and the 2 hour is normal, if this 1 hour peaks above 155, they are the people who will progress to diabetes or pre-diabetes. If it is below 155, let's say it's only 135, they are very unlikely to progress, and therefore you don't even have to do a GTT after a year or so. You can wait for 3 years or 5 years and then repeat it. Whereas if they have the value above 155, then not only you have to screen them earlier, but also advise them as you would advise a person with pre-diabetes. Ask them to lose weight if they're obese, cut down carbohydrate, and then avoid sugar, do exercise, sleep on time, reduce stress, do yoga, whatever, and that can help to prevent progressing to diabetes. Because if you don't do that, the next 2-3 years you may develop diabetes, and then all the risk for complications start. If you can postpone that by 5-10 years in your lifetime, you may not suffer due to the complications of diabetes. So the message is, when you do an OGTT, include the 1 hour also in that OGTT. Thank you.